Thank you, Senator Warner.
Senator from New Hampshire is recognized.
Mr. President, I want to begin by recognizing and thanking Senator Warner for his efforts today to organize the freshmen to talk about why it's so critical that we get something done to reform health care in this country. You know, he and I both belong to the former governor's caucus, and I really come to this debate with the years of work that I did as governor and the perspective that we've got to do something to improve the availability of health care for all Americans and certainly for the families of New Hampshire. Over the past several months, my office has responded to thousands of letters and phone calls about health care. I've traveled all across New Hampshire talking to small business owners and families who are desperate for help. I've talked to health care providers who are frustrated with the current system, and time again, what I've heard is that our health care system is not working. Costs are too high and access is too limited. The status quo is simply not sustainable. Now is the time to act. Every day in New Hampshire and across our country, families are struggling with the rising costs of health care. It threatens their financial stability and leaves them exposed to higher premiums and deductibles and puts them at risk for losing their health insurance and, in too many cases, financial ruin. According to one study, 62% of bankruptcies in 2007 were caused by a medical condition, and I have a chart that shows this very clearly. This is the 62% of those bankruptcies that were the result of the costs of medical care. What's probably even more concerning is that of those 62%, 78% of them were insured. So most of the people in this country who are going bankrupt as the result of their health care costs actually had health insurance. Health care costs are a threat to our economy, to our small businesses, and to our working families. The current health care system is simply unsustainable for our economy. As Senator Warner pointed out, it's estimated that in 2009, our nation will spend $2.5 trillion, or 18% of our gross domestic product, on health care. That means that health care costs account for 18% of the value of all the goods and services produced in this country. And if we continue on this current path, health care will make up over a third of our economy by 2040. Now, Senator Warner showed that in a chart. This is a graph that shows the same thing. What happens to health care costs if we do nothing as a portion of our entire economy of this country. And in New Hampshire, our small businesses are feeling this burden firsthand. From 2002 to 2006, there was a more than 40% increase in the cost of health insurance premiums for New Hampshire businesses. And for those of our smallest businesses, those with fewer than 10 employees, that increase was almost double, to more than 70%. A 70% increase in just 4 years for small businesses in New Hampshire. So that means that although our small business owners want to provide their employees with health insurance, many of them just can't afford it. And ultimately, it's our hardworking families who suffer. Today, the average family living in New Hampshire pays about $14,600 for their insurance premium. In New Hampshire, we have the highest premiums in the country for those people who have group rates. I just want to say that one more time, because in New Hampshire, we are paying the highest premiums in the country for group health insurance. If we continue on this current path, families will be paying almost $25,000 in the next 10 years by 2019. And again, here's another graph that shows what's going to happen to New Hampshire families. $25,000 in 10 years. This is just not affordable. Now, the good news is that we know how to bring down costs. At the Center for Informed Choice at Dartmouth, research shows that more spending does not translate into better outcomes. In fact, it shows that up to 40% of the time, patients who are engaged in the decisions related to their care will choose the less invasive and less costly procedures. These choices produce better outcomes with higher rates of patient satisfaction. The healthcare industry can do better for less. We can find savings in our system. For example, experts have estimated that we can save $5,000 per Medicare beneficiary by reducing costly hospital readmissions. I've introduced legislation with Senator Susan Collins from Maine called the Medicare Transitional Care Act. This bipartisan legislation will reduce Medicare costs and offer better support and coordination of care to Medicare patients. This will not only improve the quality of health care for our seniors, but it will also save taxpayers money. And I was very pleased to see that many of these provisions were in the mark that came out of the Finance Committee. Now, although the numbers and statistics are compelling, it's really the stories that I've heard from my constituents which best illustrate why reform just can't wait. This isn't just about policy. This is about real people. A few weeks ago, I received a letter from a young woman named Jennifer. Jennifer and her husband had recently decided they wanted to start a family. They both work for small businesses who don't offer health insurance, so they shopped around for an individual insurance plan. The policy they could afford didn't cover standard maternity care, but they were told that they would be covered in case of an emergency, if they needed a C-section, or if they had other health problems during the pregnancy. Unfortunately, Jennifer suffered a rare complication, a molar pregnancy, resulting in loss of the pregnancy and requiring extensive follow-up. But the insurance company told them that it wouldn't cover that emergency. So during their time of grieving, Jennifer and her husband are not only facing piles of medical bills, they're wondering how they'll ever be able to afford a baby in the future. No young family should have to go through this. Mr. President, we have the opportunity to stabilize healthcare costs and reform our healthcare system for people like Jennifer and her husband. We know this is not easy. It's one of the greatest challenges of our time, but the time is long past for action. We need to act now to stabilize costs and provide coverage for Americans. And I look forward to working with my colleagues on both sides of the aisle to achieve this goal.